Welcome, and thanks for watching our presentation today about ways to prevent stroke and to learn more about carotid artery disease. My name is Jennifer Pary, and I'm a stroke neurologist at CNOS. The only disclosure I have today is that I'm a co-author of a book about acute stroke, but that won't affect anything we're discussing today. The objectives for the talk that we have today are, one, to discuss the risk factors of stroke, discuss how to find carotid artery disease and what to do about it if we find it, discuss the importance of a multidisciplinary team approach to patients with carotid disease, and review the signs and symptoms of stroke, and to discuss what to do if you or someone you care about should develop those. So obviously, you're one of those that cares or is interested about preventing stroke, and we're so pleased to have you today. But why should everyone care about stroke? It's now the fourth leading cause of death, only behind heart disease, cancer, and pulmonary disease or lung disease. And unfortunately, it's still the #1 cause of disability. So not everyone that has a stroke dies from their stroke. Often they live disabled, and that's what we're trying to do, is to prevent a stroke, or if you have the symptoms, to try to be able to treat it so you're left with minimal disability. Other important facts that I want to discuss with you today is about 750,000 people have a stroke every year, and over 150,000 of these people die of stroke. 60% of those who die are women, and many of you know someone who's been touched by breast cancer, but 2 times more women die from stroke than breast cancer every year. So it's a very common cause of death and disability in women as well as men. Estimates vary in various studies that carotid artery disease is the cause of stroke in anywhere from 10 to 50% of cases. So let's talk now about risk factors for stroke. There are 2 that we can't really do much about. One is age, so as you get older, you're at increased risk of stroke. And the other is genetics. So your family traits, it's inherited, that we can't really do anything about yet, although there are ongoing trials to see if there's some type of genetic engineering we can do to prevent stroke. However, as you can see, the list is quite long of things that we can do something about. That includes carotid artery disease, which we'll discuss in greater detail in a moment. Blood pressure, we call high blood pressure, the silent killer. And if we could get rid of blood pressure problems in the United States, we could eliminate 85% of strokes. So it's a key risk factor for stroke. The important thing is it doesn't hurt. If your blood pressure is elevated, you may not be aware of this. So it's extremely important for you to work with your primary care provider to make sure that your numbers are at the goal that they recommend. Fortunately today, there are a lot of medicines for blood pressure that are affordable and low cost, so there's really no excuse for not having your blood pressure under control. Another thing we talk about is diabetes. So again, the patient has to be involved in their health care and be an advocate for themselves and know what your numbers are and know what they should be. And if you're not getting the correct results, you need to get back and work cooperatively with your primary care provider to make sure those numbers are at their goal. Another risk factor for stroke is high cholesterol. And again, we have lots of medicines that are low cost that can help prevent stroke. Interestingly, there are some blood pressure medicine and cholesterol medicines that not only help lower blood pressure and cholesterol, but also help to prevent stroke. And people that are taking these medicines, should they be unfortunate enough to have a stroke, do better and have less disability if they're on these medicines. So there's dual benefit to these medicines for stroke prevention, as well as just healthy outcomes. Another one that's really important is smoking. So if you're smoking, you have to cut down as much as you can and really quit smoking. It's one of the best things you can do for your health. And the last one we talk about is an irregular heartbeat, something called atrial fibrillation. There's a lot of newer medicines that are out to try to prevent stroke in patients with this type of problem. So here's what we're going to be talking about for the majority of the rest of the talk, which is the carotid arteries in the neck. And as you can see, there's the aorta, which is the main vessel that comes off the heart, which divides, and then eventually you see the common carotid arteries, which divide again to the internal and external carotid arteries. And the internal carotid arteries are the ones that we care the most about, because those are the ones that provide the blood flow, oxygen, and nutrients to the brain. So that's what we do ultrasound of for your carotid screenings and other things like that to look to see if those arteries are becoming narrowed. And here's a diagram or an illustration of what plaque looks like in an artery. And it's this yellow stuff that adheres to the wall of the artery and thereby causes a narrowing in the blood flow to the brain. Here's an angiogram of a patient with a very tight narrowing in the right internal carotid artery that obviously needs to be fixed to try to prevent a stroke. So oftentimes people ask me a lot of different questions about carotid artery disease, so I listed the most common ones and we'll address those now. How do I know if I have carotid artery disease? And this is such an important question because most of the time you have absolutely no idea that you have any trouble with the arteries in your neck. One of the main things we're talking about today is make sure that you get screened at a reliable center, someone that you know does quality screenings, if you're over 50 or if you're under 50 with multiple risk factors that we discussed. It's really extremely important because, as we mentioned, up to 50% of strokes can be caused by artery disease in the neck. And there's something we can do about this artery disease to prevent a stroke. You don't want to wait till it's too late, till you're having a stroke or a warning stroke before you figure this out. So sometimes doctors, they listen to your neck and they may hear a noise that's called a bruit, and that may prompt them to get a carotid ultrasound to see if there's significant narrowing there. The important thing, though, is that not always does the lack of that noise mean that the artery is normal. It could be that the artery is so narrowed that hardly any blood flow is getting through the artery. So I tell people it doesn't matter if they hear a noise in your neck, and if you have no symptoms, you still need to get screened. Then people ask me, how often should I get screened? And that really depends on how much disease you have in the arteries in your neck. If there's absolutely no to minimal disease, it's usually about every 2 to 3 years. If it's significant disease, we often do it as often as every 3 to 6 months. So let's say you attend one of our screening programs and they find out you have significant carotid artery disease. What should you do about it? The key thing I want to emphasize today is that the most important thing you can do, regardless of any type of intervention in the artery, is medical management, like we had talked about, of managing your risk factors. Being on the appropriate medications, like the aspirins and other medicines that thin your blood, statin drugs that are good for lowering cholesterol, and blood pressure medicines as well. And like we talked, they have a dual role in helping to prevent stroke, stabilize that plaque in the artery so it doesn't break off in little bits and fly up and cause a stroke. And people that have stroke on these medicines do better. And also, the thing is to make sure you follow the artery disease in your neck with carotid ultrasound, because sometimes it can get worse and you have no idea, and that's important to stay on top of and not just ignore. Now, there are surgical options for management of carotid artery disease too. One key feature that we need to discuss is the difference between arteries that are causing trouble, or what we call symptomatic carotid disease, and arteries that aren't causing trouble. So we hope to get you at a point where you haven't had any symptoms of stroke and that the arteries aren't causing trouble but need to have an intervention. And the risk of stroke from those arteries is much lower than arteries that are causing trouble. Sometimes people call it mini strokes, or they have neurological symptoms for maybe 20 or 30 minutes from a plaque that broke off in the artery. Those arteries are the highest risk arteries for having a stroke in the next few days. So those people are the ones that we need to jump on right away. The asymptomatic patients, we have a little more time, and the risk of stroke is less. But if you have transient neurological symptoms, it's important to get evaluated right away, even if the symptoms go away, because if you have significant artery disease in your neck, we might need to hop on that right away to prevent you from having a bigger stroke. There's 2 types of surgical intervention. One is called Carotid Endarterectomy, which is basically surgery, and we'll illustrate this in a moment, and the other is Carotid Stenting. So this is a diagram of Carotid Endarterectomy, and basically for this surgery, you need to go under general anesthesia. Obviously, it's performed in the hospital. And the surgeon makes a small incision in the side of your neck here, dissects down and finds the carotid artery, makes a small cut in the artery, opens the artery, and shells out that plaque that's causing the narrowing. Then they sew the artery right back up, and you're good to go. Carotid stenting is a different procedure that is done usually under sedation and does not require general anesthetic. It's done where they put a catheter in the groin, like an angiogram, and they snake it up into the carotid artery. They have a balloon that they inflate that the stent is covering. So they inflate the balloon and the stent expands, and then they deflate the balloon and the stent stays in the artery and they take the catheter out. So a lot of people say to me, well, should I have surgery or stenting? And this is a very hotly debated topic in the stroke literature. But what I say is we make those decisions on a case-by-case basis, on an individual basis. And it depends on what your other medical problems are. If you have horrible heart and lung disease and couldn't undergo general anesthesia, maybe stenting's better. If you have terrible creatinine or kidney function, the dye with the stenting could be harmful to your kidneys, and maybe you're better having surgery. Current medications that you're taking, nowadays they're putting people on certain antiplatelet medicines when they have stents in their arteries in their heart that they need to be on for a long time after they have the stents in place. And obviously, if your blood's too thin, doing surgery would be dangerous. Whereas when you're putting a stent in place, you already have a stent here, the same medicines work for the stent in your neck. So that can help weigh the balance one way or the other. The durability of the procedure is another thing. We know that surgery with carotid endarterectomy is a very durable procedure. Stenting is a newer procedure and not as well studied, so we're waiting on data, long-term data, to see about the durability of these stents. The other important thing is you want to make sure that you know what your surgeon or stenter's complication rates are. You certainly want to make sure that whoever's doing your procedure doesn't do them once a year, and that they do them on a regular basis and they have the skill and the low complication rates to give you the best possible outcome. So ask those questions of your surgeon or the stenter. The other thing I feel very strongly about is that patients with carotid disease need to be cared for by a multidisciplinary team. And that's one of the wonderful things that we offer the Siouxland community at CNOS. We have a comprehensive cerebrovascular disease center where there is a team approach to patients with carotid artery disease. So we have the neurosurgeons that do the surgery, a neurosurgeon who's trained in stenting who comes up from Omaha, and myself and my nurse practitioner that work on stroke prevention and working people up to see if they need to have a surgery or a stent. And oftentimes we'll all stand around the same film and discuss the case as a team and figure out what's best for the patient. No politics involved. And I think that's a very unique thing that CNOS offers that no one else can offer, is that nice team approach. The other thing I think is really important is that a lot of people can do these procedures. Surgeons, radiologists, neurologists, cardiologists, a lot of different type of specialties can do this procedure, either stenting or surgery. But I think the most important thing to remember is that brain doctors should take care of brain problems. You wouldn't go to the GI doctor to have your heart taken care of. So make sure that you see someone that has the skill and knowledge, that knows how to deal with brain problems, complications of their procedures, etc. I kind of touched on this already. Some of it is that why should I get my cerebrovascular care at CNOS? And that's because we cover the whole range of services in a completely unbiased fashion. Like I said, if you go to a surgeon and ask them if they need surgery, obviously that's the only thing they can do, and they'll tell you, yes, you need surgery. If you go to someone who does stenting and that's all they do and they can intervene, they'll tell you, oh, yes, you need stenting. Whereas at our institution, we take the team approach and see what's best for the patient, and that's what we do. Again, I mentioned that we're experts in the brain, and we know how to deal with brain problems. And for instance, with the Dr. Thorell who does the stenting, he knows how to get himself out of a problem because he knows how to shoot the vessels in the brain. He can intervene if a clot during the surgery went up to the brain. He knows how to go in, retrieve the clot, give a clot-busting drug. And that kind of training is not common with other specialties that do this type of stenting procedure. So it's really important that you have someone with brain expertise that knows the brain problems, knows how to take care of it, knows how to deal with complications should they arise. And the other great thing that we have at CNOS is we have comprehensive follow-up. So it's not just like you get your surgery or your stent and we say, see you later, wait till you have your next stroke. That's not how we're doing it here at all. Myself and my nurse practitioner follow up on these patients at 6 weeks, 6 months, and a year after surgery. And like I said, if you don't need surgery yet, we still follow you to make sure that we're doing the best we can to prevent stroke and that you're on all the right medicines and that we're up on the latest research and data to try to minimize your risk of ever having to have a procedure. And we want to make sure that the other side doesn't get more narrowed and that the side you had the procedure on stays nice and wide open. The other benefit that we have at CNOS for our Comprehensive Cerebrovascular Disease Center is really skilled ultrasound technicians who the majority of their work is all on cerebrovascular disease. They're not busy doing OB ultrasounds and kidney ultrasounds and other things. They're really focused on cerebrovascular disease, and their knowledge and skill is an important part of our team. Here's our CNOS neurology team. Dr. Andrews, Dr. Case, Dr. Grudem, Dr. He, myself, and my husband, Dr. Louise Pary, all see stroke patients. We're all on call at the hospitals taking care of acute stroke, and we'd really like to prevent stroke instead of having to see you in the hospital in the acute situation. Here's our neurosurgery team, Drs. Durwood, Johnson, Ragnarsson, Reeder, and Shoemaker. And here's the neurosurgeon I've been speaking about who's trained in stenting, Dr. William Thorell. He's from the University of Nebraska Medical Center. He has clinic once a month at our institution to see patients who are considering stenting or for follow-up. So that concludes the portion of our talk where we're talking about the carotid disease section. Now the important thing is I want to make sure that you know what the signs and symptoms are of stroke and what to do if you or someone you care about has those signs or symptoms. And I tell people to remember the acronym ACT, and I say act fast. So A stands for arm, face, or leg numbness or weakness. C stands for clumsiness or trouble with coordination. And T stands for trouble talking. And most strokes that occur will have one of those signs or symptoms as part of the event. It's difficult with stroke because people think it will hurt or that it will be painful in some way, much like a heart attack where you have crushing substernal chest pain. It's not that easy with stroke because it's a loss of function. So you lose the ability to feel, you lose strength, you lose the ability to see or the ability to speak normally. And so most people tend to ignore a little numbness or weakness or clumsiness that they may have. And that's the problem. We need to act fast because time lost is brain lost. And what should you do if someone you know has those symptoms? Even if it goes away, you need to be evaluated right away because like I mentioned, you could have artery disease in your neck that requires urgent intervention. Or maybe you have that irregular heart rhythm that we can treat with a different medication than you're currently taking. So call 911. That way you get the help of medically trained personnel and get to the closest emergency room as fast as you possibly can. What not to do? I usually ask this question of my patients in the clinic. What would you do if all of a sudden you became weak on one side? And invariably they say, well, I'd call my wife, or I'd call my daughter, or I'd call my doctor. Some of them even have told me they call me. And I said, well, I hope I'm in clinic that day because I work part-time. So the answer is to call 911. And really, time is of the essence because every minute brain cells are dying and decreases your chance of a good outcome. So the sooner you get to the hospital, the more efficiently you can be cared for and treated. And some people say, well, why should I act fast? Why should I worry about it? I don't like the lights and sirens. I don't want to, have the hubbub in the neighborhood. The ambulance is expensive. What if I'm wrong? What if it's not a stroke? And I say, let us make that decision. Give us the chance. Give us the opportunity. This drug that they're showing here is called TPA, or tissue plasminogen activator. It's the only FDA-approved treatment for stroke, and it's a clot-busting drug. So basically you have to get to the hospital. They have to do a picture of your brain to make sure you don't have any bleeding in the brain, because obviously this is a clot-busting drug and can cause bleeding. They have to test you and do some blood work and other things and get the neurologist involved with your care. And then they can give an IV dose of the medication, a bolus, and then the rest is infused over an hour. And this clot-busting drug can make a huge difference in people's lives. I've seen people come in paralyzed and unable to talk, unable to see, and walk out of the hospital normal. Now, not everyone has that great of an outcome, but based on the clinical trials, there's a huge benefit for this, and people do better if they're treated with this medication overall than people that aren't. So just remember, if you have the signs and symptoms of stroke, get to the hospital immediately. So in conclusion, I want to thank you again for your interest in stroke prevention and the CNOS Cerebrovascular Center of Excellence. If I didn't stress enough earlier, I want to stress again now that no matter what you do, you need to take an active role in your healthcare and manage your medical risk factors. Like we talked about, diabetes, high blood pressure, smoking, irregular heartbeat, high cholesterol, all those things you can play an active role with the cooperation of your primary care provider. Get those risk factors under control at goal and try to prevent yourself and your loved ones from having a stroke. Secondly, carotid artery disease is a common cause of stroke, which can be prevented. The important thing is that it's silent. You may not know there's any disease in the arteries in your neck, so it's important to get screened at a reliable center. And keep getting screened. Don't do it once. It's like a mammogram. Do it on a regular basis. And it's really important, in my opinion, to have a multidisciplinary team approach to patients with carotid artery disease and stroke prevention, and that's what we have here at CNOS. Finally, know the signs and symptoms of stroke like we discussed. Remember the term act fast. A for arm, leg, and face numbness and weakness. C for clumsiness or trouble with coordination. T for trouble talking. Then act fast and get to the closest emergency room immediately. I'd like to thank you for your time and attention today.